So I'll just share a little bit about the same time that this was going on. Our health system was apologizing for the explicit racism. That there was a black hospital in town and a white hospital in town, and so Cone Health was the white hospital, and there was L. Richardson that was a black hospital, and there were 9 black physicians and dentists who sued. The case went all the way to the Supreme Court, and we had never really dealt with that as a hospital health system. The courts decided it, and we integrated in '63. And so that's a big thing to sweep under the rug, and it has a lot to do with trust. And so I think Josie has painted us in a pretty flattering light here, but we were just in 2016, we were just apologizing to the community for that and to the last living survivor of that court case. So, like, institutional racism, it's deep in you and you carry it forward for decades. And so it's not only the redlining that impacts people's health, but it's the way the health system participates or ignores, the history. And so I would say, as being at Cone Health and in this work now, the thing that I think is missing for the institution still is that we are accountable to the community for this. And I think we still see ourselves as accountable to the health system. And that's a fundamental change that I think it's still the journey, right? And I think there are enough voices that will help us get there as a health system, but that is part of the embedded institutional racism that we still are working against. So fantastic presentation, Josie. And I just want to say we're probably not worthy of all the nice things you said.
No. You know what's interesting though, Laura? And I'll say that and to everyone, take note. That type of acknowledgement did not happen prior to the last several years. That's not the conversation that we started out with Cone. So although I was very gracious, it helps me to continue to see light in a tunnel for Laura Vale, this person at Cone at this leadership level, to acknowledge and lift that up without me having to bring it up. And that seems simple, right? But that's not what was happening 3, 4, 5 years ago. That was the conversation and the type of dialogue we were waiting on, and the residents were waiting on. Like, we came into a meeting one time and residents was like, we're waiting. Like, you know what I mean? And there was like, nobody was ready for that. So to have that acknowledgement, I thank you for even being willing to even share that, because that's the type of change and that's the type of dialogue and communication you want to have in institutions, because that's where it starts.